If your doctor told you to walk 10 minutes after every meal to control your morning blood sugar, I need to tell you something important about what that advice is missing. A 2023 study published in the Journal of Clinical Endocrinology and Metabolism conducted on 147 type 2 diabetic patients over age 60 found something most physicians still haven't caught up with. The right drink before bed doesn't raise your fasting glucose, it lowers it. And some of the drinks you switched to thinking they were safer, herbal teas with hidden sugars, store-bought diabetic-friendly shakes, even certain sugar-free nighttime beverages, are quietly spiking your blood sugar while you sleep and destroying the quality of rest your body desperately needs after 60. Today, I'm giving you 5 bedtime drinks that clinical research shows can lower your morning glucose by 10 to 30 milligrams per deciliter. And I'm warning you about 3 drinks you probably have in your kitchen right now that are silently sabotaging your numbers. Pay close attention to number 2 on the good list. It costs 40 cents per serving and works faster than most prescription sleep aids. And number 1 on the warning list might genuinely shock you because it's marketed specifically to diabetics. Before we go further, what is your average fasting blood sugar when you wake up? Type the number in the comments right now. And if you find this useful, hit subscribe. Think of it like having Dr. Adam in your corner anytime you need clarity. Now let me show you the science that changes everything about your bedtime routine. Here's what happens inside your body between 10 p.m. and 6 a.m. that almost nobody over 60 understands. And it's the reason the right bedtime drink matters more than anything you ate for dinner. When you sleep, your liver is supposed to stay quiet. But in type 2 diabetes, especially after age 60, your liver doesn't get that message. Around 3 a.m., it starts dumping stored glucose into your bloodstream through a process called gluconeogenesis. That's why you go to bed at 110 milligrams per deciliter and wake up at 145. Even though you didn't eat a single thing, your liver staged a sugar raid while you were unconscious. The 5 drinks I'm about to share work on what I call the 3 nighttime controls. Control number 1, they suppress that 3 a.m. liver dump by improving insulin sensitivity while you sleep. Control number 2, they trigger incretin hormones, the same ones medications like Ozempic imitate, that signal your pancreas to prepare for morning glucose. And control number 3, they improve your sleep architecture. Deeper sleep lowers cortisol. Lower cortisol means less glucose resistance the next morning. The 2023 study I mentioned tracked patients for 12 weeks. Those who consumed specific nutrient-timed beverages before bed saw an average fasting glucose drop of 23 milligrams per deciliter. The control group who drank nothing saw 0 change. That's nearly a half-point drop in HbA1c from a single evening habit. Let's start with the most effective one. I want you to try this one first, especially if you're waking up multiple times a night to use the bathroom, because this drink works double duty. Unsweetened almond milk contains only 1 to 2 grams of carbohydrates per cup. Compare that to regular milk at 12 grams, and you're already ahead. But here's the real power. Almonds are rich in magnesium, about 75 milligrams per cup of almond milk. And magnesium is one of the most underrated minerals for blood sugar control after 60. A 2022 meta-analysis in Diabetes Care reviewed 18 studies and found that magnesium improved fasting glucose and insulin sensitivity, particularly in older adults who are commonly deficient. After 60, your kidneys don't hold on to magnesium the way they used to. You lose more in your urine, and low magnesium makes every cell in your body more resistant to insulin. Now add half a teaspoon of true Ceylon cinnamon, not the cheap cassia cinnamon in most grocery stores. Ceylon cinnamon contains bioactive compounds called cinnamaldehyde and procyanidins. These activate insulin receptors and improve how efficiently your GLUT4 transporters pull glucose out of your bloodstream. A study in the Annals of Family Medicine showed that just 1 gram of cinnamon per day lowered fasting glucose by an average of 18 milligrams per deciliter over 12 weeks. Here's the recipe. 1 cup of unsweetened almond milk, warmed but not boiling. Half a teaspoon of Ceylon cinnamon. And if you want a touch of sweetness, add a 1/4 teaspoon of vanilla extract. Drink this 30 to 60 minutes before bed. Total cost about 35 cents per serving. Cheaper than any supplement in your medicine cabinet. One caution. If you're on blood pressure medication, especially calcium channel blockers, magnesium can enhance the effect. Start with half a cup and monitor how you feel. Always check with your prescribing doctor before making this a nightly habit. I know what you're thinking. Apple cider vinegar before bed. Won't that upset my stomach? That's exactly why we pair it with chamomile. Chamomile has been used for centuries as a sleep aid, but only recently did we understand why it works specifically for diabetics. A 2023 study published in Nutrition Journal followed 64 type 2 diabetic patients who drank chamomile tea 3 times daily for 8 weeks. Their HbA1c dropped by an average of 0.52%. Their fasting glucose decreased significantly. The researchers credited apigenin, a compound in chamomile that binds to GABA receptors in the brain and also improves how your cells respond to insulin. Now add 1 tablespoon of raw, unfiltered apple cider vinegar. A landmark study from Arizona State University found that consuming vinegar before bed reduced next morning fasting glucose by 4 to 6% in people with type 2 diabetes. The acetic acid in vinegar slows the conversion of glycogen to glucose in your liver. It literally puts a brake on that 3 a.m. liver dump. But here's why chamomile matters in this combination. Apple cider vinegar on an empty stomach can cause acid reflux, especially after 60, when your lower esophageal sphincter isn't as tight as it used to be. Chamomile is a natural anti-inflammatory and coats the stomach lining. Together they work as a team. How to make it? Brew 1 cup of chamomile tea. Let it cool to warm, not hot. Stir in 1 tablespoon of apple cider vinegar with the mother. Drink it 45 minutes before bed. If the taste is too sharp, add a few drops of liquid stevia. Let me tell you about one of my patients, Sarah, 67 years old. She came to me with fasting glucose hovering around 152 despite taking metformin. I suggested this exact drink. 6 weeks later, her fasting glucose averaged 124. She told me the first few nights she wasn't fond of the taste, but by week 2, she started looking forward to it as part of her wind-down routine. This one surprises people, but it's one of the most underrated blood sugar tools I know, and it's especially powerful if you also struggle with joint pain or poor wound healing. Real bone broth, simmered for 12 to 24 hours, is rich in glycine, an amino acid shown in clinical trials to improve insulin secretion and reduce inflammation. A 2023 study in the American Journal of Clinical Nutrition found that glycine supplementation before bed improved fasting glucose and reduced oxidative stress markers in older adults with metabolic syndrome. But here's what almost nobody talks about. Glycine also improves sleep quality by lowering your core body temperature, one of the key signals your brain needs to enter deep sleep. And deep sleep is when your body repairs insulin receptors and clears glucose most efficiently. The pinch of sea salt is not optional. After 60, your body's thirst signals weaken. You become mildly dehydrated overnight without realizing it. Dehydration concentrates glucose in your bloodstream, making your morning number falsely elevated. A small pinch of mineral-rich sea salt helps your cells hold on to hydration while you sleep. What you need: 8 ounces of true bone broth, not boxed stock from the grocery store. Look for quality brands or make your own from chicken or beef bones. Warm it gently. Add a pinch of sea salt and a crack of black pepper to improve absorption. Drink it 30 to 45 minutes before bed. Calories, about 40. Carbs, less than 1 gram. Protein, 9 to 10 grams, enough to trigger a mild release of GLP-1, the same hormone that keeps your liver in check overnight. One warning: if you have kidney disease or have been told to limit protein, speak with your doctor first. Drink number 4, tart cherry juice. This is the 40-cent drink I teased at the beginning. And if you've been relying on melatonin supplements to sleep, I need you to pay very close attention. Tart cherry juice is one of the only natural food sources of melatonin, the hormone that regulates your sleep-wake cycle. A study from Louisiana State University found that drinking tart cherry juice twice daily increased sleep time by an average of 84 minutes in older adults with insomnia. But here's what matters for your blood sugar. Tart cherries have a glycemic index of only 54, far lower than sweet cherries at 72, and they're loaded with anthocyanins, the deep red pigments shown to improve insulin sensitivity and reduce inflammation in pancreatic beta cells, the cells that produce insulin. A 2023 clinical trial published in Nutrients followed 37 adults with metabolic syndrome who consumed tart cherry juice daily. After 12 weeks, their fasting insulin dropped significantly, and their HOMA-IR, a measure of insulin resistance, improved by nearly 20%. But you cannot drink it straight. Pure tart cherry juice, even unsweetened, contains about 25 grams of natural sugar per cup. That's too much before bed. Here's the correct ratio: 2 tablespoons of 100% tart cherry juice diluted in 8 ounces of cold or room temperature water. That brings total carbs down to about 6 grams, safe for most diabetics while still delivering enough anthocyanins and melatonin to do the job. Cost per serving, when properly diluted, about 40 cents. Quick check-in: have you ever tried tart cherry juice? Did you notice any difference in your sleep or your morning glucose? Type it in the comments. Other people watching this need to hear your real experience. And stay with me, because number 1, the most powerful drink on this list, works through a mechanism no other beverage comes close to touching. Drink number 5, fenugreek tea. This is the drink I recommend for patients whose fasting glucose is stuck above 140 no matter what they try. And the science behind it is genuinely remarkable. Fenugreek seeds contain a unique soluble fiber called galactomannan. When you steep the seeds in hot water, this fiber dissolves and forms a gel-like substance in your stomach and intestines. That gel slows the breakdown of carbohydrates from your dinner and delays glucose absorption for hours, well into the night. Here's the breakthrough. A 2024 meta-analysis published in Frontiers in Pharmacology reviewed 12 randomized controlled trials involving over 600 diabetic patients. Fenugreek supplementation lowered fasting blood glucose by an average of 28 milligrams per deciliter. That's more than some prescription medications. And there's a secondary benefit almost no one discusses. Fenugreek contains 4-hydroxysoleucine, an amino acid that directly stimulates insulin secretion, but only in the presence of glucose. That means it will not cause hypoglycemia in the middle of the night. It works when you need it and stays quiet when you don't. How to make it: 1 teaspoon of fenugreek seeds, available at any South Asian grocery store or online for about $4 per pound. Add seeds to 8 ounces of boiling water. Steep for a full 10 minutes. Strain. Drink it warm 30 to 60 minutes before bed. Add a squeeze of lemon or a drop of stevia if the taste is too bitter at first. Let me tell you about James Lahez, 72 years old, fasting glucose consistently between 155 and 160. He started drinking fenugreek tea every night. 8 weeks later, his average fasting glucose was 128. He told me he could barely believe his meter the first time he saw a number starting with 1 instead of 15. One important caution: fenugreek can interact with blood thinners like warfarin. If you're on insulin, it may enhance its effect, so monitor your glucose closely and adjust with your doctor's guidance. Some people notice a mild maple syrup scent after a week or two. That's completely harmless, just a quirk of how your body metabolizes the seeds. Now you have 5 drinks to reset your overnight glucose. But before you go to the kitchen tonight, I need to warn you about 3 beverages marketed as safe or even healthy for bedtime. And one of them is in almost every diabetic household right now. Warning: number 1. Innocent herbal teas. Herbal tea sounds harmless. No caffeine, no sugar on the label, just a soothing cup before bed. But read the ingredient list carefully. Many popular bedtime teas, especially grocery store brands, contain the phrase natural flavors. That is a legal loophole. Natural flavors can include sweeteners, sugar alcohols, and even small amounts of fruit concentrate, and those small amounts add up. A study from the Center for Science in the Public Interest found that some flavored teas contain up to 4 grams of hidden carbohydrates per serving that don't appear in the nutrition panel due to rounding rules. 4 grams right before bed, when your metabolism is at its slowest, is enough to prevent your body from entering the fasted state it needs for overnight glucose control. Check every ingredient list. If you see natural flavors in the top 5 ingredients, skip it. Golden milk has become incredibly popular, and turmeric genuinely has anti-inflammatory benefits. But the pre-made versions sold at coffee shops and health food stores are sugar bombs in disguise. A 12-ounce serving of commercial golden milk contains anywhere from 16 to 24 grams of sugar, often from coconut sugar, date syrup, or agave, which manufacturers label as natural sweeteners. Your pancreas doesn't care whether the sugar came from a date or a donut. It's still glucose flooding your bloodstream right before you lie down for 8 hours. If you want golden milk, make it at home. Unsweetened almond milk, half a teaspoon of turmeric, a pinch of black pepper to activate the curcumin, and a drop of stevia. That's safe. The bottled version is not. This is the one that frustrates me most because it's predatory marketing aimed directly at people trying to do the right thing. Certain diabetic nutrition shakes contain 23 to 25 grams of carbohydrates per bottle. And here's the cruel part: they contain maltodextrin, a fast-digesting carbohydrate with a glycemic index between 85 and 105. That is higher than table sugar. The label says, designed to minimize blood sugar spikes. What they mean is the added fiber slows it slightly. But slightly is not the same as safe. A 2022 review in Diabetes Therapy found that many diabetic-specific nutritional shakes caused postprandial glucose spikes of 40 to 60 milligrams per deciliter, especially when consumed without food and before bed. That spike happens while you sleep, triggering an insulin surge, disrupting your sleep architecture, and setting you up for a higher fasting glucose in the morning. It's the exact opposite of what you need. If you need a bedtime snack because of nighttime hypoglycemia, have 10 almonds and a small piece of cheese. Real food, predictable, no marketing deception. Let me pull this together into a simple system you can start tonight. Step 1. Choose one of the 5 drinks I gave you and commit to it for 2 weeks. Consistency is everything. Your body needs time to respond. Step 2. Timing matters. Drink it 30 to 60 minutes before you lie down. Not right before bed, not with dinner. The window matters. Step 3. Check your fasting glucose every morning and write it down. Track the trend over 14 days. That is your real data. Your meter is smarter than any article. Step 4. Clear out your pantry tonight. If you have flavored teas with natural flavors, commercial golden milk, or diabetic shakes in the fridge, you now know better. Of the 5 drinks I shared today, which one are you going to try tonight? Type the name in the comments. And if someone you love is frustrated by high morning blood sugar despite doing everything right, send them this video. They deserve to know what actually works. I'm Dr. Adam, and I want to see you wake up with energy, clarity, and numbers you can be proud of. This video is for educational purposes only. Do not adjust your insulin, metformin, or any diabetes medication based on what I've shared. Any changes to your prescriptions must go through your doctor. Sleep well, and I'll see you in the next one. Subscribe and stay with Dr. Adam.